Imagine you're on the field. You hear the sound, you see the ball going high and far. You run fast to get there, you dive and catch! It's out. You celebrate and feel like a champ. All of this happened in just 3 seconds. Your brain processed and controlled all of these actions. That's the power of our brain. It's made of over 80 billion neurons that are constantly working. These neurons need energy and oxygen that comes from the blood. If the blood supply to any part of the brain is blocked, it can die quickly. This is what happens in a stroke. Strokes are a major cause of disability and death. An early recognition and quick treatment can save the brain. Let's ask Dr. Smart about it.
Hello and welcome. I'm Dr. A from Smart Clinic. Let's talk about stroke today.
Dr. A, how does the brain work? And what is a stroke?
Our brain is an amazing gift. It controls everything we do. It also helps other organs perform their functions. It sends signal through a complex circuit of nerves reaching all parts of the body. Different parts of the brain perform different functions. The front part controls each and every movement we do. It also performs complex tasks of critical thinking, planning, and problem solving. It controls our behavior and makes up our personality. The middle and back parts receive all the information coming to the brain through our senses. There is constant information coming from what we see, hear, smell, taste, or touch. It tells the rest of the brain what this information means and what to do with it. The sides help us in hearing and understanding what is said. It also helps us in speaking and writing. It works with the central parts to control our emotions such as feeling excited and happy, feeling sad, or having fear and anxiety. The lower back part controls our balance and makes our movements smooth and well coordinated. And lastly, the brainstem connects our brain to the rest of the body. It sends signal from the brain to the body and brings information from the body to the brain. It also controls our heart and breathing. Our brain is constantly working. For all this work, it needs energy and oxygen that comes from blood. There are many blood vessels in the brain. A stroke happens due to blockage of one or more blood vessels with a clot. As a result, blood and oxygen cannot reach that part of the brain. The affected area gets damaged and starts to die within few minutes. Time is very critical. It is important to identify strokes and provide treatment as soon as possible. Every minute counts.
Dr. A, what are signs that someone is having a stroke? And what should we do?
Since different parts of the brain control different functions, the symptoms depend on which part of the brain is having a stroke and how much area is affected. Common symptoms can be weakness of one arm, or one leg, or one side of the face, or one whole side of the body. Stroke can also present with loss of feeling on one side, loss of vision, or loss of consciousness. It can also present with difficulty in speaking. This can be inability to speak at all or saying words that don't make any sense. Usually these symptoms appear suddenly. 1 minute the person is okay, and shortly after they are having symptoms. It is very important to quickly recognize if someone is having a stroke and take action right away. A quick way is to remember the word fast. F is for face. Look at the face of the person and ask them to smile. See if the smile looks normal and symmetrical or if one side is different than the other. A is for arms. Ask the person to raise both arms in the air as if they're holding a tray. See if both arms are strong or if one is weaker. S is for speech. Talk to the person and ask them simple questions like, "What is your full name?" or "How old are you?" "Tell me your phone number," or any other simple question like that. See if they can speak normally. Any of these three things don't look right, then go to T, which means time. Time is very important. Call 911 or emergency services right away. There is no time to lose. The person needs to be taken to the nearest hospital that can take care of people with strokes.
Dr. A, how is stroke treated?
The first few hours are very important. When a person is brought to the hospital, doctors will quickly assess them and get a CT scan of the head along with some other tests. They will try to find out quickly if the person is having a stroke or is this something else causing these symptoms. If the stroke started within a few hours, doctors will consider using special medicines that break the clot. These are clot busting medicines. Some strokes can also be treated with a special procedure to remove the clot. These treatments can greatly improve the chance of recovery. However, these medicines and procedures do have some risks. This is why it is very important for doctors to carefully decide who will benefit from this treatment and who will not. Unfortunately, many times strokes are identified late and such treatments cannot be used. Doctors will also try to investigate the reason for having a stroke and treat that condition to avoid future strokes. Another very important part of treatment is rehabilitation of the disability caused by stroke. The recovery of the damage done by stroke is different in each person. They will need physical therapy and rehabilitation to get better. Even if the initial symptoms are very severe, with time and physical therapy, people can recover a lot more over next few months. But this requires lots of patience and support.
Dr. A, how can strokes be avoided?
Many factors increase the risk of having strokes by making the blood vessels narrow and sticky. These are the same problems that also increase the chance of having heart attacks. These include smoking, excessive use of alcohol, having high cholesterol, diabetes, or high blood pressure. If you smoke, remember, it's never too late to quit. See our video on smoking cessation to learn more about it. A good control of blood pressure, diabetes, and cholesterol is very important in preventing strokes and heart attacks. Make changes in your diet, do regular exercise for at least 30 minutes 3 times a week, and take medicines prescribed by a doctor. Watch our videos on these topics to learn more about them. Some people and families have a higher tendency of having blood clots. Blood clots can also form in people with irregular heart rhythm, a condition known as atrial fibrillation. Consult your doctors to see if you need blood thinners or other treatments.
Fantastic fact! After we are born, our brain grows to 3 times its original size in the first year and keeps growing until 18 years of age. The human brain weighs 1.5 kilograms. This is only 2% of a person's weight, but it uses 20% of the oxygen in the blood. Humans have the biggest brain for the size of our body among all creatures. Let's be grateful for this amazing gift. Use it for learning new skills, creating new ideas, and making the world better.